The Princess of Wales announced today that she's been diagnosed with cancer.
She says it was found after she underwent abdominal surgery back in January, and she is now in the early stages of what they called preventative chemotherapy. And joining us now in studio to talk a little bit more about it is Dr. Hardeep Phull. He is an oncologist with Palomar Health. Thank you for joining us.
Thank you for having me.
Well, you heard sort of the, the revelation that she does have cancer, but the description was not going into much detail. So based on her age of 42 years old and what has been revealed to this point, what is your speculation of what she might be facing?
Absolutely. And I tell my own patients, avoid speculation. We don't know till we know. And some of these things are sensitive. They could be sent for further testing. We know she had a surgery. We know she thought it was benign and there were some cancer cells found at the time of surgery. That's actually a relatively good thing to have, and that's kind of interesting to say. It's a good thing to have cancer, but to find it early. She's in what we call the adjuvant therapy phase. In other words, there's microscopic cancer and we can clean it up. And the great thing about chemotherapy in a setting like this is it goes everywhere and cleans up what the surgeon maybe couldn't see at the time of the operation.
So what happens next for her? Even going through preventative chemotherapy, how drastic is that for her? And also, how does her age factor in here, being 42 years old? And does that help her long-term outlook?
Absolutely. And again, it's speculation to know what kind of cancer.
Yeah.
But in general, early stage cancer of the abdomen, we're assuming there's different types of cancers there, including colon cancer, ovarian, uterine. I don't want to speculate because she clearly said in her Twitter post today, please don't speculate, please don't bother me, respect my privacy and identity. That's what's so important. And you know, chemotherapy, in a 42-year-old, she'll do fine, she'll do great. But the issue with chemotherapy is you can have symptoms like tiredness, loss of hair, nausea, vomiting. She may not be in the public eye much. And it's hard for someone of her stature to lose her privacy and identity, which she's already lost by revealing this, which must have been so hard to do, especially to her children. It seems like she took a few months to tell even her own family. So I think what she wants from the world is to say, I'm going to be okay. Use this for every cancer patient to empower others. Don't lose faith and hope, which she says in her video, and just keep fighting strong. I have every confidence in the world she's going to do great based on what I've seen so far.
And the royal family, they did reveal that she was having the surgery way back when. Talk about the timeline as it's gone, because a lot of people were a little confused as how she could have a major surgery like that and not know till what has been reported till the end of February that she had some cancerous cells, and then the treatment. The palace originally had announced they thought she'd be back in the public eye by Easter. That clearly is not going to happen. So can you kind of lay out the timeline for us?
Sure, absolutely. I think on January 16th she went in to get that abdominal surgery. We know it was a planned surgery, which means that we knew about it. It wasn't an emergency. She likely didn't have severe symptoms. We also know that she took about 13 days, I believe, to recover, and then she went home and recovered some more. Again, it's speculation at this point, but my own patients have privacy to know what they have, and they may not reveal it to everyone.
But is it uncommon to learn about the cancerous cells that long after a surgery? It takes that long sometimes to determine?
I would say it takes 1 to 2 weeks with current methods of looking at surgical specimens under a microscope and doing tests with immunohistochemical markers and things like this. We now have DNA tests to even look for cancer in the blood. So if she had a DNA test later on after surgery, that would have been about 3 months after. I have a feeling she did know a few weeks after the surgery, and she had to keep it private, not just for us, but her own family. And I think she was planning such a phase like this after a prolonged recovery to then eventually start chemotherapy. Again, speculation, but that's what I would assume would happen.
One of the first people, of course, that came to my mind in this whole situation is Will, the future King of England, who found out his dad and his wife have cancer within a short period of time. Can you talk about, you said she obviously wants to stay private in this situation as much as possible, but the importance of having some of the most famous people in the world both having cancer, and what that might do to help or empower other people who are going through something similar.
Absolutely. I mean, we've heard of so many cancer stories recently in the news, and certainly King Charles III had prostate cancer, and the Duchess of York, I think Sarah Ferguson, had melanoma, and then of course Princess Kate. I think it shows that cancer does not discriminate. It's the emperor of all maladies, as Siddharth Mukherjee said in a book. And it does not discriminate. The key is to do screening, to empower each other to look for cancer and know that we can treat it. We have so many tools in our modern armamentarium, like immunotherapy, chemotherapy, surgery, and radiation. I think her journey points out in a very graceful way the fact that you're going to be okay, don't lose faith and hope, we can empower other lives. They obviously have a platform to do that on a very large scale. And so I think she has the whole world behind her. Certainly me and all of us in San Diego, we wish her well.
Yeah, and certainly as an oncologist, you know how important it is to have that support group around you, that you even offer support to the families and friends of people going through cancer treatments, correct?
And I think patient advocates, families and friends are some of the most important because they help people process what they're going through. Because we all go through these 12 stages of grief and denial. And what I saw today in her very authentic video, which I thought was extremely heartfelt, is someone who's processed this, been through the tears, and probably choked up saying all of these words, but did it in such an empowering way. I think it's going to touch the world.
Can have a huge impact on a lot of people. Dr. Full, thank you so much for the insight, the input here, and hopefully we'll be relying on you once again as we learn more information here. Thank you so much.
Thank you.